Rivers State Governor Wike has commended the United States government for working with the state government to reduce the prevalence of HIV/AIDS in the state. Also, the United States Ambassador to Nigeria, Ambassador Stuart Symington, said that the U.S. President's emergency plan for AIDS relief administered by the U.S. Center for Disease Control, U.S. Department of Defense and U.S. Agency for International Development is implementing an antiretroviral treatment search program in Rivers State to identify and provide treatment to approximately 180,000 people living with HIV who have not previously received such. The two leaders spoke at the Government House Port Harcourt on Tuesday during a high-profile meeting on the promotion of health of Rivers people.
On behalf of the government and people of the state, most sincerely thank you for this honor, at least recognizing our little contribution to making sure that this scourge of HIV is being eradicated in our state. And I thank their team for the support they have given to our state.
Governor Wike assured the United States government that his administration will continue to fund programs that will reduce the prevalence of the healthcare challenge.
The team is doing in order to eradicate HIV is so important. And the way they have taken the work, the way your mission have taken the work in funding, we feel so glad that we are your partners and will continue to do what we are supposed to do. Because health is key. Education is key. With education, you'll be able to talk to people to understand the implications of the HIV. We have about 115 sites, for prevention of mother-to-child transmission of this HIV. And that is as a result of the support. And our government is willing to spend more, whatever resources we have, so as.
He said that the healthcare program of Rivers State government is yielding results as the immunization statistics of the state has moved from 54% to 82%.
I just got a letter right from UNICEF that the rate of immunization from 44% now to 82% in the state. And that they commend us because this was possible because of the infrastructural improvement.
Speaking further, Governor Wike thanked the United States government for insisting that votes count in Rivers State during the last general elections. He said that the United States government ensured that democracy survived in the country despite the fact that it came under threat.
And thank you for the support that you gave that the votes must count in Nigeria. Not only Rivers State, but in the entire country. You and your partners from Europe and other countries make sure that democracy is sustained in this country. And for the technical support you also gave to the Independent National Electoral Commission.
It will be recalled that the Rivers State Governor, Wike, recently announced that the Rivers State government will pay the user fees for the people living with HIV in the state to access free treatment. In his remarks, the United States Ambassador to Nigeria, Ambassador Stuart Symington, said that the U.S. government's $75 million budget increase for HIV control activities in Nigeria and about $25 million allocated for art such activities.
It requires the help of all of you, including all of you in the press. If your family members have a chance to get tested, and if they find that they have it, the cure is there in the treatment of the drugs. So this is the chance, a surge of enrollment of people that need it.
Ambassador Symington thanked Governor Wike for announcing his intent to eliminate user fees for people living with HIV. The U.S. delegation was in Rivers State to advocate for elimination of user fees for all people living with HIV, antenatal care charges for pregnant women living with the virus, and other barriers hindering people living with HIV from accessing health services. The ambassador emphasized Governor Wike's pronouncement serves as an example to other states and federal government to eliminate such user fees. On August 19, 2019, Ambassador Symington paid a similar visit to Akwa Ibom State Governor Udom Emmanuel.
Under the leadership of this state government, in partnership with the United States, the people of Rivers have a chance to do something extraordinary for each other, for the state, for Nigeria, and for the world. And that is to find people who have HIV/AIDS and make sure that they get on treatment. So that's the point of this visit today. A surge, something that hasn't been done by anybody but can be done here in Rivers.
He noted that the increased funding to make antiretrovirals available will enable people living with HIV live healthy, productive lives until the day a cure for the virus is found.
It will be done only by the people of Rivers. It cannot be done by anybody else. The leadership of the government, the support of the governor and his whole team, but above all, it's up to you.
The ambassador noted that the disbursement of the additional PEPFAR HIV funds are contingent upon Nigerian federal and state governments reducing or eliminating financial barriers for people living with HIV, access to services, in particular fees charged by healthcare facilities for non-essential services or those already provided by PEPFAR.